NCLEX practice questions for nursing students. Here are 20 questions. See if you can answer them correctly. Check out the next video for the correct answers and explanations. Good luck. Fundamentals of nursing. The nurse is reinforcing teaching with a client about using a cane. Which of the following instructions should the nurse provide? A. Hold the cane on the weak side. B. Move the weaker leg first when walking. C. Move the cane forward before stepping with the stronger leg. D. Keep the cane level with the umbilicus when standing. Pharmacology. A client with hypertension is prescribed furosemide, also known as Lasix. Which electrolyte imbalance should the nurse monitor for? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypercalcemia. Medical surgical nursing. A nurse is caring for a client with chronic obstructive pulmonary disease or COPD. Which oxygen delivery system is most appropriate for this client? A. Non-rebreather mask. B. Nasal cannula. C. Venturi mask. D. Simple face mask. Infection control. The nurse is caring for a client with Clostridium difficile or C. diff infection. Which of the following actions should the nurse take? A. Perform hand hygiene with an alcohol-based sanitizer. B. Place the client in droplet precautions. C. Wash hands with soap and water. D. Wear an N95 mask. Pediatric nursing. A 3-month-old infant arrives at the clinic for a wellness checkup. Which findings should the nurse report to the healthcare provider? A. Inability to roll from back to stomach. B. Inability to hold head up while on stomach. C. Presence of Moro reflex. D. Absence of teeth. Maternity nursing. A pregnant client at 36 weeks gestation reports dizziness and lightheadedness while lying on her back. What is the best response by the nurse? A. This is a normal part of pregnancy. B. Lie on your left side instead. C. Sit up for a few minutes before lying down again. D. You need to increase your fluid intake. Mental health nursing. A client with schizophrenia is experiencing auditory hallucinations. What is the most appropriate response by the nurse? Is it A. I don't hear any voices. B. The voices aren't real, so ignore them. C. What are the voices saying to you? D. If you take your medication, the voices will go away. Nutrition. Which of the following food choices is best for a client with iron deficiency anemia? Is it A. Yogurt and a banana? B. Spinach and lean beef. C. Oatmeal and orange juice. D. Baked potato and sour cream. Pharmacology. A client is prescribed warfarin, also known as Coumadin. Which statement by the client indicates a need for further teaching? Is it A. I will have regular blood tests to check my INR. B. I will eat green leafy vegetables daily to improve vitamin K intake. C. I should avoid aspirin unless my doctor approves it. D. I should use an electric razor to prevent cuts. Let's dive into respiratory nursing. The nurse is caring for a client experiencing an acute asthma attack. What medication should the nurse anticipate being ordered? Is it A. Albuterol, B. Montelukast, C. Ipratropium, or D. Loratadine? Now, on to cardiac nursing. A nurse is reinforcing discharge teaching for a client with heart failure. Which statement indicates a need for further teaching? Is it A. I will weigh myself every morning. B. I should notify my provider if I gain 2 pounds in one day. C. I should limit my sodium intake. Or D. I can drink as much water as I want to stay hydrated. Moving on to medical surgical nursing. A client with diabetes mellitus is experiencing confusion, sweating, and tremors. What is the nurse's best action? Should they A. Administer glucagon intramuscularly. B. Give a glass of orange juice. C. Check the client's blood pressure. Or D. Encourage the client to lie down. Postoperative nursing. A client who had abdominal surgery 24 hours ago reports sudden severe pain and a popping sensation at the incision site. What should the nurse do first? A. Apply firm pressure to the incision. B. Call the healthcare provider. C. Cover the wound with a sterile saline dressing. D. Assess the client's vital signs. Which action should the nurse take? A. Encourage the client to drink large amounts of fluids. B. Teach the client to tilt their head forward when swallowing. C. Offer solid foods before liquids. D. Place the client in a supine position. The nurse is assisting with the care of a client in labor. The fetal heart rate suddenly drops from 140 to 90 beats per minute. What is the priority action? A. Reassess in 10 minutes. B. Place the client in the Trendelenburg position. C. Apply oxygen via face mask. D. Call the healthcare provider. Let's move on to question 16, which focuses on medication administration. The nurse is preparing to administer digoxin to a client. Which finding should prompt the nurse to withhold the medication? A. Blood pressure of 118/72 millimeters of mercury. B. Heart rate of 55 beats per minute. C. Potassium level of 4.0 milliequivalents per liter. D. Respiratory rate of 16 breaths per minute. The nurse is reinforcing teaching about home safety for a client with a history of falls. Which statement indicates a need for further teaching? A. I should install grab bars in my bathroom. B. I will keep a nightlight on in my bedroom. C. I should remove my rugs to prevent tripping. D. I will wear socks when walking on wood floors. The nurse is assessing a toddler with dehydration. Which finding requires immediate intervention? A. Dry mucous membranes. B. Sunken fontanelle. C. Heart rate of 180 beats per minute. D. Capillary refill of 2 seconds. The nurse is caring for a client who is experiencing alcohol withdrawal. Which of the following interventions should the nurse anticipate? A. Monitor for seizures. B. Administer naloxone. C. Provide a high-sugar diet. D. Encourage caffeine intake. The nurse is caring for a client with hypothyroidism. Which clinical manifestation should the nurse expect? A. Heat intolerance. B. Weight loss. C. Bradycardia. D. Increased appetite.